The following program is intended to educate the public on a variety of cosmetic procedures and is paid for by the participating doctors.
And welcome to Body Beautiful. This is a show where we talk with local professionals about the latest and greatest in cosmetic procedures and medical devices. We also take your calls live on the air. And with us today, we have plastic surgeon Dr. Elizabeth Lee, along with a patient. And we're going to be talking about mommy makeovers. Later, we'll be taking your calls, answering any questions you might have for the doctor. Here's the phone number, 800-440-4884. We'll also be posting the phone number to the doctor's office, so be ready to jot that down. And before we get started, any advice we give you today, you'll certainly want to consult your own physician as well. Welcome to the program. Let me establish here first that we are all mommies here, right?
Mm-hmm. Absolutely.
Okay, how many kids?
4.
Plastic surgeon, practicing doctor, TV doc, and 4 kids to boot. Okay, and Sandy?
Mother of 3.
Mother of 3, and you look terrific.
Well, thank you.
Well, having children is a beautiful thing. Sometimes what happens to the body afterwards is not such a beautiful thing. Doctor, why would someone want a mommy makeover?
Well, because having children, being pregnant, having children, nursing children changes your whole body. Not everybody falls apart, but a fair number of women do. Their abdominal walls stretch out, the breasts change shape, the breasts change volume, and it can kind of be uncomfortable trying to figure out where your body is and how you feel about everything.
Yeah, when you are pregnant, you do notice a lot of changes going on, and sometimes you just think, hey, is this my body anymore?
Right.
Will it ever get back?
I think that if we woke up, went to sleep not pregnant, woke up 9 months pregnant, that none of us would survive.
Right,
so the
you'd
fact
go into shock.
Yeah, the fact that it's a gradual process, I think, makes it a lot more tolerable. But everything does get stretched out, and in the several months after delivery, things will bounce back, and some people tighten right back up. There are plenty of women I know who don't have stretch marks, who don't have muscle separation in their abdominal wall, and those people do great. But there are others that just fall apart like tissue paper.
Okay, we're sitting here looking at you, Sandy, and you're in great shape. You look terrific.
Well, thank you.
Do you want to confess here, you have had a mommy makeover?
I have had a mommy makeover.
Really?
My stomach, I'm 5'2", and I'm a runner, and I'm very athletic. But my first pregnancy, my oldest is now 11. My muscles went out, and then they went back like this, and they never came back together. No matter how much I worked at it, I couldn't.
So you're a runner. I mean, obviously, we want to establish here, you know, a mommy makeover is no substitute for diet and exercise.
Correct.
Right.
None whatsoever.
But you did all that.
And it wasn't cosmetic for me. It was the pain I was experiencing with my muscles, not my core not being strong.
Right. What happens with this separation of the muscles in the midline, which we call rectus diastasis, is that the whole balance of all the core abdominal muscles, or all the muscles that give strength to your body, those muscles are out of balance when the rectus muscles are not in the correct position. Mm-hmm. So in some ways, you know, Sandy might not have complained that she didn't like the way her belly looked, but certainly there is this functional component that can occur with the separation of the muscles that prevents you from being able to support your back properly. And in a lot of cases, as women try to exercise to get those muscles back, they may actually be doing more injury to themselves because the muscles are in the wrong position and they pull against themselves.
Okay, so this happened with your first child?
Yeah, and then I proceeded to have, obviously, 2 more. And it came down to the relaxation. I could never just relax and sit. And because I was always sort of holding myself together, I had a lot of back pain.
So can I ask, did you have to wear Spanx or a girdle or something?
No, I didn't have to do that. I really just worked hard on my body and held myself together.
But you probably also didn't.
But I took Advil.
Right, all the time. Right.
I took Advil all the time for 6 years straight.
Okay, so this wasn't just an aesthetic decision.
No.
This was actually a medical one.
This was a medical one, in my mind, and I think in your mind.
Well, I think that that was a big component of it. There are a lot of women who have separation of the muscles and have a lot of stretched out skin and are uncomfortable about the way they look, and that is a major motivator for women to have tummy tucks after they've had pregnancies. But I think that in Sandy's case, it was much more of a, there are things I need to do, and my body won't let me do them.
But you know what's unnerving? I mean, here you've just gone through this, and you want your pre-pregnancy body back, and it's not coming back no matter how hard you work at it.
I wanted my body back.
Yeah, and you feel like, well, excuse me, is there some help here?
Yes.
We jumped ahead. We didn't really talk about what a mommy makeover is, and we're going to be able to break that apart and actually show some photographs. We need to go to a quick break, but for more information about Dr. Lee, you can call her directly, 510-704-2170, or you can check her out on the web at artfulsurgery.com. When we come back, we'll take your phone calls and show you some before and after pictures on Body Beautiful.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor. The opinions expressed on the program are those of the guests and not those of KRON TV, its management, employees, or advisors.
Hi, welcome back to Body Beautiful. We have plastic surgeon Dr. Elizabeth Lee here along with her patient Sandy, and we're talking about mommy makeovers, and actually there's some pretty candid conversations here, very revealing. Later we'll be taking your calls, answering any questions you might have. Here's the phone number, 800-440-4884. We'll also be posting the phone number to the doctor's office, so be ready to jot that down. And our disclaimer here, certainly you want to have a second opinion before you have any medical procedures done. Dr. Lee, you have some before and after pictures. Gives people an idea what's really going on here. So let's go ahead and roll those.
Good, because we also didn't get the chance to discuss the fact that part of the mommy makeover involves doing something to restore the breasts and doing something to work on the abdomen, on the abdominal wall.
So those are the two primary areas.
So those are the primary areas that we talk about when we use the phrase mommy makeover. So this is a patient who had 2 babies, is obviously very thin, very good physical shape, and her breast just basically disappeared.
From nursing?
From nursing. And this happens to some women. So she had a breast augmentation as part of her mommy makeover, and the pre-op pictures are on the top and the post-ops are on the bottom.
So you just took her to where she was before
just
the babies?
About. I think she admitted that she got a little bit more than she had.
Well, and why not?
And why not? But she certainly was not interested in looking like a stripper. She just wanted to feel that she had a restoration of how she felt about her body beforehand. And this is a different patient, but this one we're showing the tummy tuck component. This woman also had her had breast surgery done, and her breasts are probably in a different picture. So the befores are on the top and the afters are on the bottom.
Okay, and so her tummy now, she doesn't have that little jelly belly?
She doesn't have that jelly belly, and almost universally patients, even if they're not aware of back discomfort that they were having, tell me that they feel a lot better and they move a lot better after they recover from the tummy tuck.
Great in a swimsuit.
Right, and this is her picture. She had a small breast reduction.
Okay.
And so
and
her
a lift?
pictures, well, the reduction always involves doing a lift too, because the nipples tend to go to a position that are lower than what we usually like. And so when we talk about a lift, we're talking about moving the nipples back up to a more youthful position.
Okay. And any more pictures here?
And this is another patient who, as part of her mommy makeover, had a breast reduction surgery. So here you can see that we've really decreased the volume of the breast in addition to moving the nipples.
And those scars, are those pretty fresh? Do those lighten up?
Those scars are fresh, and that's a great question. I mean, this picture was taken at about 3 months, and you can expect scars to fade pretty much to a fine white line within about a year, particularly on the breasts. Now, this is a breast reduction, so the scars are a lot bigger for a reduction than they would be for an augmentation, or even for an augmentation with a small breast lift. Those procedures we can, that kind of small lift we can do with an incision right around the areola, which is the pigmented area around the nipple, and we don't have to make all those scars.
Okay, and one more here.
And then this is a patient who, this was her before and after of her tummy tuck, and her breast pictures were the pictures that we saw the one before.
Okay, that is amazing.
Yeah. Well, I mean, this poor woman came in and said, you know, I don't know, I think maybe I'm being frivolous about this, and she looks like she's 6 months pregnant, and that's with her trying to hold her belly in, and there's no.
But she's not. She's
no.
How far?
No, her child was 3. Her youngest was 3. And you know, she's relatively small. Her baby's weighed 9.5 pounds, and she just was not going to come back, no matter how much. And she actually, this picture of her is actually after she lost 20 pounds. Exercising
so
at the
that's
gym.
Just the muscle that just is distended?
Well, it's not that it's distended. It's that the 2 strip muscles which run up the center of the abdomen, of the abdominal wall, that are called the rectus abdominis muscles, get stretched apart from each other. And that connective tissue between them, if it stretches, does not come back and rebound, so that those muscles sit out to the side instead of being right abutting each other in the midline.
And I touched upon this before the break, but the worst thing that can happen after you've had the child, you work out, you try to get your body back in shape. Some people just look at you and they say, you know, oh, you've just let yourself go. You must be sitting on the couch eating bonbons.
I think Sandy can address this, because Sandy is certainly one of my patients who, you know, came in a model citizen in terms of exercising and being at an appropriate weight. And
people would say, well, you don't need plastic surgery, as if it's something that's just cosmetic.
Right. Frivolous.
Frivolous.
Okay.
I mean, because it is cosmetic in many ways, but it also, you know, for me, it had to do with the muscle separation and the pain I was experiencing.
Can I get personal with you? What exactly did you have done?
Oh, well, she did. I had a 4-inch gap in my stomach muscles, and she cut me from hip to hip and went in.
She had a tummy tuck.
And I had a tummy tuck.
Sewed
me and full on brought down the skin and sewed me back up, created a new belly button, and she added extra cup size here as well.
So she got a little bonus from that as well. Which you were happy with that?
Yes, very happy.
Okay, now we need to take a quick break. The phone lines are lighting up. I'm sure people are saying, okay, like, tell me a little bit more about this. But we'll be right back. For more information about Dr. Lee, call her 510-704-2170 or check her out on the web at artfulsurgery.com. When we come back on Body Beautiful, we'll continue talking about mommy makeovers. Plus, we'll take your calls, I promise. For more information about our show, go to KRON4.com and click Body Beautiful. Once there, you can see videos of past shows and get contact information for the doctors we featured, as well as listings for future shows. Welcome back to Body Beautiful. With us today, we have plastic surgeon Dr. Elizabeth Lee, along with her patient Sandy. We're talking about mommy makeovers. Later, we'll be taking your calls, answering any questions you have. Here's the phone number, 800-440-4884. We'll also be posting the number to the doctor's office, so be ready to jot that down. You know, I said later we'll be taking phone calls. Let's go ahead and take a call, shall we? Linda from Mountain View, good morning.
Yes, good morning.
Good morning. Do you have a question for the doctor or Sandy? She's willing to answer.
Yes, I do. I wanted to ask, I'm 60 years old. I've seen one of those body that you just showed with this woman, looks like she's still pregnant. Well, mine's not as bad as that, but it is, and I have stretch marks. Now, with someone being 60 years old, would that take longer, or would it affect their health?
You know, that's...
Years old?
There's really no age, provided your health is good, that is too old to do this. But of course, this is what's all discussed when you come in for consultation. And the thing is that if your health is good, I've done tummy tucks on women who as old, I believe, as 65, and that particular patient walked to her second post-op visit a mile. I couldn't believe it. So, you know, in general, we operate on younger patients, but if you're in good health, 60 is not too old to do this.
Yeah, and I want to jump in here. 60, old?
Yeah, really, that's not old.
Forget about it.
No.
Right?
No, not at all.
Okay, well, now that begs the question, too. How long do you have to wait to get a mommy makeover after you've had a child? And if you plan to have more children, do you need to wait?
Yeah, you do not want to have any surgery on your abdominal wall if you're planning on having more children. There are obviously no enormous studies done seeing what happens to women who get pregnant after tummy tuck, because they're only incidental case reports, and we know that the baby does fine and the mommy does fine too, and they don't split open like a watermelon. But obviously it's a big operation, as Sandy can tell you, and it's not something that you want to do if you're not done having children.
Well, plus all that good work that you've done, you don't want to undo it and then have to go back in.
It is a painful recovery, so you definitely want to wait.
And we want to talk about that.
Sure.
This is not something just capricious, you know.
No. And so, Sandy, like, how much time did you take off from your activities to recover from this?
Well, it was several weeks, but the first, I mean, she forewarned me. It was the first 24 hours that are truly the most difficult.
But you're back to running? You're doing everything?
Oh, I'm back to running. Yeah, absolutely. Within a month or two.
Yeah, probably a month. And a lot of it goes with how the patient feels, and we work together pretty closely post-operatively so that there's no cookbook for when you're going to go back to your running and
individual basis.
And patients who are big exercisers will often say to me at the pre-op visit, when can I go back? And I say, well, the first thing is you're going to have to want to go back. And they're like, yeah, I'm going to want to go back tomorrow. And okay, let's just see how it goes, right?
But look, we've all been to the grocery store and the checkout stand, and there are those magazines with the stars that have just had a baby, and it seems like the following week they're back looking slim and trim and ready to go. I mean, can we give a reality check here? They probably have personal trainers.
And they probably have somebody who's fixing all of their meals for them. And some of those pictures may be airbrushed.
Altered.
Yeah, I mean, you know, any of us who've had children know that it doesn't snap back, even if it snaps back. You know, I would personally, I don't think I would ever need a tummy tuck because my muscles have not separated. I'm overweight. I wouldn't even consider having any kind of surgery until I got